Good afternoon from Istanbul, Turkey, where we are gathered today to tell you about WHO's recommendations for the influenza vaccine composition for next season's Northern Hemisphere. And to speak to you about this very important topic, today we have Dr. Maria van Kerkhove, Director ad Interim for the Epidemic and Pandemic Management Department at WHO. Next to her, we have Dr. Wenqing Zhang, who heads our unit on global respiratory threats. Next to her, we have Dr. Richard Bebby, who's a director of WHO's Collaborating Center for Studies on the Ecology of Influenza in Animals and Birds at the St. Jude Children's Research Hospital in the US. And finally, we have Professor Nicola Lewis, who's director of WHO's Collaborating Center for Reference and Research on Influenza, and that's at the Francis Crick Institute in London, United Kingdom. So we'll be discussing WHO's recommendations that come off this week's discussion of global data, intensive consultations on what the trends have been, and Dr. van Kerkhove will describe that shortly. A request to the journalists who are joining us to please include your name and your outlet so that once we open it up for questions, we know how to call on you. Over to Dr. van Kerkhove.
Thank you, Shagun. Good morning, good afternoon, and thank you very much for joining us today. So influenza, or the flu, is an acute respiratory infection caused by influenza viruses that are commonly circulating all around the world. There are around 1 billion cases of seasonal influenza annually, including 3 to 5 million cases of severe influenza. It causes an estimated 290,000 to 650,000 respiratory deaths every year. Influenza continues to keep us on our toes, not only because of the burden it causes, but because it is constantly changing. These changes require us to stay vigilant and update vaccines accordingly. For this, we rely on the strong efforts of the WHO Global Influenza Surveillance and Response System, or GISRIS, which has served the world for nearly 75 years. GISRIS is the global mechanism for surveillance, preparedness, and response for seasonal, pandemic, and zoonotic influenza. It provides a platform for monitoring influenza epidemiology and disease and serves as a global alert system for novel influenza viruses and other respiratory pathogens. It is composed of 165 institutions in 138 countries, areas, and territories, and has continued to expand and reinforce its global coverage. For example, in 2025, the network welcomed 5 new national influenza centers in the African region, in the Democratic Republic of the Congo, Ethiopia, Mauritania, Mozambique, and Niger. This expansion strengthens influenza capacity across the African continent, improving geographic representation and enhancing the timely detection and sharing of influenza viruses and data. This network is sharing data and viruses throughout the year from 140 to 160 countries that allows us to track the circulation and evolution of influenza viruses in real time. This represents approximately 10 to 12 million samples collected and tested by GISRIS laboratories each year. Based on the surveillance and the lab data collected by GISRIS and partners throughout the year, and 4 days of intense consultation and discussion this week, WHO has today announced updated recommendations for influenza vaccine composition. We do this twice a year to ensure that vaccines for the Northern and the Southern Hemisphere are updated to match the circulating viruses. Today's announcement includes recommendations for the 2026-2027 seasonal influenza season in the Northern Hemisphere, and also includes a zoonotic influenza report, which summarizes the antigenic and genetic characteristics of recent zoonotic influenza viruses and related viruses circulating in animals, and makes recommendations for relevant candidate vaccine viruses, or what we call CVVs, to strengthen preparedness for future pandemic threats. Let me begin with the seasonal influenza recommendations. WHO is recommending the inclusion of subclade K, influenza A H3N2 J.2.4.1 into next season's vaccine. This virus emerged in July-August 2025 and rapidly spread around the world, contributing to an earlier and more intense influenza season in several countries. Subclade K quickly became the predominant circulating influenza strain globally and is now included in the 2026-27 Northern Hemisphere seasonal influenza recommended vaccine composition. Although influenza B circulation has remained low, we are also recommending an adjustment to the influenza B component of the vaccine, giving ongoing changes in the virus. Turning now to zoonotic influenza, including avian influenza and swine influenza. Since the last meeting in September 2025, 25 human infections of zoonotic influenza have been reported to WHO from 6 countries. Most of these individuals had direct exposure to infected animals or contaminated environments, and no human-to-human transmission has been reported. Based on how zoonotic influenza viruses are evolving, WHO is issuing updated recommendations for candidate vaccine viruses, which can be used quickly to develop vaccines if a pandemic threat emerges. WHO is recommending the development of a new CVV for avian influenza, Influenza A H9N2 virus. The full recommendations are available on WHO's website, and earlier this morning, we shared the recommendations with global vaccine manufacturers and regulatory agencies in the public information session. Lastly, I want to express my deep appreciation for GISRIS, all of the national influenza centers, the 9 WHO collaborating centers, essential regulatory laboratories, H5 reference laboratories, and many other associated laboratories and institutions that make GISRIS a true global system addressing the threat from influenza and other respiratory viruses. The efforts of this resilience demonstrated by the national influenza centers and also by the WHOCCs and our ERLs are tremendously important, especially in the evolving, complicated landscape in which we work with the threat of an influenza pandemic, real and ever present. I would also like to thank our other institutions, including the World Organization for Animal Health and the Food and Agriculture Organization of the United Nations Network of Expertise on Avian Influenza, or OFFLU, for their continued contributions of information, clinical specimens, viruses, and associated data that are important to track and understand the evolution of influenza viruses. GISRIS has become the model of global public health in the complexities of our modern world. Without the continuous, high-quality work of this network, influenza vaccine composition recommendations and the protection they provide would not be possible. Thank you.
Thank you, Maria. As Maria said, information on the recommendations is available on our website, and you would have also received the press release, which includes a link to these latest recommendations. So now the floor is open to questions. We invite you to raise your hands. And while we wait for a few seconds, for that, I'd just also like to say that we'll be sharing Maria's remarks with you after this press conference, along with, again, all the links that you need and a recording of this press conference. So I see we have a question from Belisa Godinho from W Magazine. Belisa, please unmute yourself and ask your question.
Thank you for taking my question. What improvements have been made to candidate vaccine virus CVVs for zoonotic influenza, and how do the updated CVVs enhance global preparedness for a potential zoonotic spillover? Thank you.
Thank you. I'll turn first to Dr. Richard Bebby, who's an expert in zoonotic influenzas, to speak to us about this.
Yeah, certainly. So again, if I received the question correctly, it was about the updated CVV for zoonotic influenza. Was that correct? Yes. So as Dr. Van Kerkhoven just said, during this meeting, we discussed a lot of the activity ongoing at the human-animal interfaces this particular period. So between September and February, there were 14 H9N2 influenza virus infections detected in China. This is a subtype of virus we know circulates widely in poultry populations. And certainly over the last few years, we've had quite a number of human infections detected. And so the update this year was to include an additional H9N2 CVV, so candidate vaccine virus, to a list of available reagents. This was simply done to reflect a little bit of evolution that's occurred in one group of these viruses. So our existing reagents, our existing CVVs didn't match some of these newer H9N2s as well as we would like. So it's simply a keeping ahead of things, just in case one of these viruses do happen to start spreading, which, at this stage they are not. And the CVV was really done for preparedness purposes. So again, just keeping, I guess, track of the way these viruses are changing. But certainly it doesn't signal any particular change in what these viruses are doing, what we're seeing in terms of activity, in terms of human infection, in terms of the disease, is very similar to what we have been observing over the past few years.
Thank you. I think Wenqing has something to add.
Yeah. So in addition to Dr. Webby said about the new virus selected this time for the development of candidate vaccine virus, actually the developing of new or updating the candidate vaccine virus for zoonotic influenza is an ongoing process. Actually, it is an ongoing process to improve the pandemic preparedness and response. So this has been done through the ongoing monitoring and the risk assessment by the global influenza surveillance and the response system. If there's anything new, anything developed, the WHO CCs will group together with the laboratories from the veterinary sector, from FAO and WUA, the Offload network, and they will work on the selection and then subsequently the development of new candidate vaccine viruses.
Thank you. Just checking if Nicola would like to add anything.
No, I think at the moment that's covered it.
Okay, thank you. Our next question comes from NPR, National Public Radio. We have Jonathan Lambert. Jonathan, please unmute yourself.
Hello, thanks for taking my question. It's about samples. Excuse me, getting over a cold. It's about sample shipments from national influenza centers to WHO collaborating centers. I know in the last press conference, you'd said that sample shipments had continued after a slight dip last year. Can you provide any more detail about the volume of samples sent this year and how it compares to previous years, and where the funds to resume shipments came from? Thank you.
Thank you, Jonathan. I'll first check with Wenqing. Please go ahead.
Yeah, so thanks very much for your question. Last year, because of the sudden gap of the financial situation, there was a drop of the number of the shipments being made from national influenza centers to WHO collaborating centers. So there's a drop of the number of shipments. However, if we look at the number of the viruses being shipped from countries or shared with the global system, the number actually didn't drop. Rather, the total number actually increased in comparison to the same period of last year. So although there was a drop of the number of shipments last year, great efforts were being made among WHO collaborating centers to make sure the best use of available resources, to make sure the most representative viruses are being shared with WHO collaborating centers in time to inform the vaccine composition. Actually, in September last year, indeed. So that actually has enabled the WHO on top of the evolution globally and to make the right decision.
Thank you. Maria, do you have?
Yeah, I think I'd like to answer this as well, because we get this question quite a lot. Certainly with the sudden withdrawal of funds to WHO, there was a lot of questions of whether or not, we even had the question of whether or not GISRIS would continue. And I just want to reinforce how important GISRIS is for the world. It's been in operation for almost 75 years, and the commitment of WHO to maintain this and strengthen this couldn't be stronger. But more importantly, what we see from all of our WHO collaborating centers, our national influenza centers, and all of the governments that actually support those laboratories reinforce how important it is to keep this up, the importance of information sharing of specimens around. And yes, we did see that dip, but we've been able to make that up, and we've been more smarter and more efficient, if you will, in how we move these samples around. And certainly any money that WHO has, and we have spoken to a number of member states to provide additional support for GISRIS. Our focus of using the money that comes to WHO is really on low-income countries and middle-income countries. Many high-income countries and middle-income countries have actually put in the funds themselves to help ship those samples around the world. So my message is of reassurance in terms of the importance of this system, the importance of this system working, not relying on any one country alone, but more than 138 countries that have these labs in them. But even more importantly, there are samples shipped from countries that don't have national influenza centers. So we want to reiterate its importance, how committed WHO is and our member states are to making sure that this system, GISRIS, is highly operational and is strengthened year on year.
Thank you, Maria. We have a number of journalists online, but no hands raised for questions. So just a reminder, if you do have a question, to raise your hand. In the meantime, I'd like to ask Professor Lewis, could you summarize for us the last influenza season, what that looked like? I know it made a lot of headlines, but what's this assessment, now that we're in nearly March, what did it look like, and what can we predict for the next season?
So we saw some very interesting disease dynamics in the last reporting period. Initially, particularly in the Southern Hemisphere countries, we saw a predominance of H1. But then, as Dr. Van Kerkhove was saying, we saw the emergence of the H3 viruses. And these first emerged in July and August in 2025. And they increased in frequency really quite rapidly and started to spread to other geographic regions from the region that we first identified them in. And what this led to was actually interesting dynamics in the Southern Hemisphere season, where they'd had an H1 season up to this point, but then the H3 viruses started to emerge in Southern Hemisphere countries and actually extend the season that we saw, particularly in countries such as Australia. And we know that H3 viruses can cause severe disease, particularly in at-risk groups. So this really extended the period that influenza was impacting countries in the Southern Hemisphere. We also saw an early start to some influenza seasons in some Northern Hemisphere countries, particularly notably in the UK and in Japan. This certainly wasn't true across the Northern Hemisphere. Some countries, even within Europe, saw a normal start. Other countries saw maybe an advance of 5 weeks in the start of their influenza season. And much of this starting to the influenza season was being driven by these subclade K H3 viruses. So I think we've continued to see these subclade K viruses circulate, but more recently we've started to see influenza B starting to rise in some countries, particularly in North America and Eastern Asia. We haven't seen so many of the H1 viruses circulating at this point, but we really continually monitor right the way through the reporting period, because sometimes influenza can take us by surprise and we see late season dynamics which can alter the properties of the viruses as they evolve.
Thank you, Nicola. Just checking if anyone would like to add any points that covers it. We have a follow-up question from Belissa from W Magazine. Belissa, please go ahead.
Thank you. And how does WHO evaluate uncertainty when influenza evolution is particularly rapid or unpredictable? Thank you.
How do you manage the uncertainty?
The question is, how do you manage the uncertainty, right, Belissa?
So, if I may, influenza continues continuously evolves. And our job as the GISRIS network, particularly in partnership with our national influenza centres and collaborating centres, is to really stay abreast of this evolution continuously and not just wait for each of the vaccine recommendation consultations. So we work tirelessly throughout the year with our partner countries and national influenza centres to really make sure that we're right on top of the way these viruses are changing, and to also allow us to readily react to any new epidemiological situation that we face. And this was certainly true with the emergence of the subclade K viruses, where collaboratively we did some very rapid assessments of these viruses in relation to vaccine strains and also in relation to human serology and population immunity, to really try to understand as quickly as possible in near real time any potential effects that we might expect to see in relation to the emergence of the new strains. So I think it's really one of the strengths of GISRIS that we are able to flex according to what we see in the evolution of these viruses. And so I think that adds resilience to the network, and the way that WHO is able to coordinate this network means that in near real time, we can change course or reassess depending on what we're seeing as a signal in the disease.
Thank you.
Can I add to that? Because I just want to also thank the members of GISRIS again. I don't think we can thank them enough, because this illustrates in managing this uncertainty in the changes in these viruses. It really reiterates the importance of the timely sharing of information, the ability to test patients, of course, for clinical care, but also to understand what viruses are circulating, for sequencing, to understand the evolution of these viruses, and to rapidly share among trusted partners across this network. I think if you were participating in this meeting, what you would see, and I missed some of the most intense discussions, but you'll see it's almost like a family, in the sense these individuals from these labs have been working together for so long. They trust each other, they know each other. The work of the labs it's just so robust that the sharing of this information can lead to intense discussion, constructive discussion, and timely actions as we move forward. So not only are we seeing the importance of sharing of information, but the geographic coverage around the world is also important. We don't want to have pockets of information where we don't know where flu is circulating. So that's why the expansion of GISRIS into many other countries covering all over the world is so critical, so that we aren't missing what might emerge. Because as you said, we have to be on our toes, and we have to think forward and anticipate what might happen, so that not only do we see what's actually happening, but we can actually take that next step forward to either warn the world through risk assessment, update vaccines, but also update other interventions that we know keep people safe from flu.
Yeah, so also let me add a few words on this. This is exactly this unpredictability nature of influenza viruses actually requires that there is a highly functioning global system. And this recognition started almost 75 years ago. Next year, we are going to celebrate the 75th anniversary of this global network. And it, as Dr. Vankerkov and Professor Luis said, this network truly needs to be global, because we don't know the next new strain, where, when it will emerge. But we need to pick up as rapidly as possible.
Thank you, Dr. Zhang. Next, I'll invite Preeti Patnaik from Geneva Health Files to unmute and ask her question.
Thanks for taking my question. I wanted to know, while the negotiations on the pathogen access benefit sharing system is still underway, but potentially whether any of these viruses could be listed as one of the pathogens of pandemic potential. And the second question is what it would mean for GISRIS to work with a WHO coordinated lab network in the context of the PAB system. Thank you so much.
Thanks, Preeti. I'll turn to Dr. Vankerkov.
Yeah, thank you very much, Preeti. And yes, I know you're following very closely the negotiations of the IGWIG, or the Intergovernmental Working Group. And as you know, and as everyone knows, they are actively negotiating the annex to the pandemic agreement that was adopted in May. And this annex is about the pathogen access and benefit sharing system. So I can't get ahead of those discussions because they are ongoing. But I first want to say how impressed I am with those discussions and the negotiations that are ongoing. They are thoughtful, they are considered, and all of the member states are really working towards finalizing that annex by May. Having said that, yes, there's lots still to be developed with the PABS-based system. Certainly we know from WHO, we know that influenza is a pathogen with epidemic and pandemic potential. We have had pandemics of influenza before. The most recent one was in 2009 with the H1N1 PDM09, and that virus is still circulating. But we are also looking at these zoonotic influenza viruses that could potentially spark a pandemic. They have not yet, but we are constantly on the lookout, and this is what the GISRIS system is doing, and these candidate vaccine viruses are. So certainly we are looking at how WHO as the Secretariat will, let's say, evolve, forgive the pun there, our work in support of member states. Remember that we are the Secretariat of member states. We do as they ask us to do. But we want to also let you know that the GISRIS system is so fundamentally important, and that will not be dismantled. We will be working with the member states of how the PAB system and what you've called the WCLN, the WHO Coordinated Lab Networks, those are still being negotiated and how that works. But certainly the laboratories that are part of GISRIS are essential for dealing with pathogens with epidemic and pandemic potential. This network deals with influenza, but of course there are other lab networks that deal with other types of pathogens like yellow fever or dengue, or I could go on and on, or coronaviruses. But let's wait to see what happens with the member states, how they continue to negotiate. And then we will be guided by the next steps as they instruct.
Thank you, Maria. Wenqing?
Yeah, I think at the moment, probably it was also worthwhile to mention that pandemic influenza preparedness PIP framework, which was adopted in 2011, this year actually is going to celebrate its 15th anniversary. So for influenza, at the moment we call the negotiation PIP, but for the sharing of influenza viruses and access to the benefits, this PIP framework was adopted 15 years ago. So actually the PAB system, if we are talking about in the influenza, virus sharing and access to benefits has been functioning for many years.
Thank you. Thank you, Wenqing. So we've run out of questions, but before we close, since we were meeting to discuss vaccines, vaccine composition was the point of this meeting that we had this week. I'd like our panel to answer, do we want to reinforce vaccination for high-risk groups? What did the last season tell us about vaccination? Nicola, would you like to start?
So absolutely. I think the emergence of the subclade K really did reinforce that in at-risk groups, particularly in an H3 predominant year, it's ever more important to advocate for safe and effective influenza vaccine and to use it not only in at-risk groups, but also more broadly in the general population. So I certainly support the evidence that we gather each season and also support the general principle that influenza has a huge impact on public health. But we have safe and effective vaccine that we can use to risk mitigate. And I think that's the strongest message we can send. And it's certainly true that GISRIS functions as a system to really advocate for that public health benefit at the end of the day.
Thank you. Anyone would like to add? Wenqing?
Yeah. So for influenza disease, influenza vaccines is a primary measure to reduce the morbidity and mortality. And the safe and effective vaccines available for dozens of years, indeed. So what WHO has been doing is to generate evidence to help countries to decide its vaccination policy itself. And another note is that we're talking about seasonal influenza vaccines, but the efforts in seasonal influenza vaccines will be able to contribute directly to the response to zoonotic influenza, as well as the pandemic influenza vaccine response as well. So this is a systematic portion of efforts as has been captured in the global influenza strategy, which was introduced in the World Health Assembly in 2020.
Thank you.
Yeah, and if I could just add to that, yes, of course, we have recommendations for the use of influenza vaccines, as has been said, but we are also addressing issues related to questions about vaccines. There are a lot of questions, not for influenza vaccines necessarily, but for vaccines in general. And we are listening to people. We are listening to populations that have questions. What is this vaccine? What is in this vaccine? How do you know it's safe and effective? If I vaccinate my child, how do you know that they are going to be safe? And these are legitimate questions that need to be answered. And they're answered with scientific study. They're answered with public health, the use of these vaccines in many, many, many different countries. We are also working to address misinformation, disinformation. There are some willful campaigns that are out there that are trying to undermine the importance of vaccination and these safe and effective vaccines for influenza and other vaccines. And we're working with many different groups on this, whether it's youth groups, whether it's patient groups, working certainly with medical professionals, but even beyond that, working with faith-based leaders, because many people seek information from people they trust. So we as an organization are working to make sure good information is out there so that you as individuals and for your family can make informed decisions. But our responsibility is not only to make recommendations of what's in the vaccine, to make sure that they are the most protective against severe disease and death, but also to support governments, as Wenjing has said, to set policies in their countries. And then working with those governments to make sure that the implementation of the vaccination programs are strong. So there's a lot of different things that we're addressing. It's not just the vaccine itself and get vaccinated. Of course, we want you to get vaccinated, but it's also addressing some of the concerns and the questions that are out there. Many, many, many of these are legitimate, and we take these very seriously. And we are constantly working to improve our own communication around this to address any of that uncertainty, because of course there always is. But to make sure that you make the best informed decision that you can for you and your family.
Thank you, Maria. That brings us to the end of this press conference. I'll just check if there's any last thing anybody needs to say, any message we need to get out there. No, we're good. So thank you to you for your time. Thank you to the journalists who've joined us. We will be sharing a recording of this press conference and related links with you shortly. And with that, I thank you.